Good evening, Dr. MC Patel, sir.
Yes.
Sir, everybody knows you, but still I will complete the formality of your introduction. Dr. MC Patel, sir, he was Vice President in FOGSI in the year 2018. He was Committee Chairperson of Ethics and Medico-legal Committee of FOGSI in the year 2011 to 2013. He was Organizing Secretary in AICOG 2017. He was President Ahmedabad Obstetric Gynec Society in the year 2010. He was President in Ahmedabad Medical Association in the year 2007. There are multiple posts. I cannot narrate it. It is very difficult to cover up every post which he had given. He had been, rather I can say, that obtained. But I would like to mention specific thing that he has collected more than 1,000 eyes in eye donation, and he is official surgeon of Red Cross Society. So welcome, sir, to this webinar.
Thank you, Sharma ji, for kind introduction, and very good evening. So it is nice gesture on part of you to discuss this type of situation and to be helpful to our FOGSIan colleague as a medical legal counselor. So let us discuss very interesting situation. In our day-to-day practice, our FOGSIan friends face this type of situation many times. Say for example, center is recognized for services of medical termination of pregnancy. Person is qualified to perform medical termination of pregnancy. Patient is minor with early pregnancy. Say for example, 8 weeks pregnancy. Can one terminate pregnancy? One, and should he or she inform police? Two, and one more thing, which special precaution or abundant caution we may say should one take not to end up into any kind of litigation?
Okay. So, sir, as far as I have understood, that this is the minor patient. So,
yes.
Minor means below 18 years. So, whenever any minor patient comes with pregnancy, that means it is a case of sexual assault against minor. Because now, according to the definition, below 18 years, everybody is considered minor. So, now there are three things which we should keep in mind. First of all, according to POXO Act, that is Protection of Child Against Sexual Offences. So POXO Act, according to POXO Act in 2019, according to Section 19 of POXO Act, it is mandatory to inform police. So whenever there is an apprehension on your part that some sexual assault is going to happen in future against minor, or if you have knowledge that some sexual offense has happened against some minor, then it becomes your duty to inform police according to POXO Act. And according to Section 21 of POXO Act, if you do not inform police, then it amounts to an offense and there is provision of imprisonment up to 6 months. So it is mandatory to inform police. Now, the second thing which I want to add here is that suppose you want to inform police. So how to inform police? So it should be information in writing and acknowledgement should be taken according to POXO Act. So in most of the cases, police people do not know even that it is mandatory to inform. So they don't become ready to give acknowledgement in writing. So in such circumstances, there are 2-3 ways to inform police. First of all, you can inform on number 100, dial number 100 and inform them so that it will be there in the diary. It will be recorded in the official police diary. If it is not possible, then you can inform by email or fax. Nowadays, fax and email number of local police stations are available and you can fax them or email them. So that is another provision. And third thing, in many of the cities, there are child welfare committees. So if you inform child welfare committee, the number of child welfare committees are already displayed by government at different banner, different by posters or at different places. So you can call CWC and you can inform CWC. If you inform child welfare committee, that amounts that you have informed police. So that is the way of informing police. Now, second thing is that how to terminate. So you have to, whenever patient is minor, as you know, according to Dharmadas versus Mori Bibi's case, the consent of minor is null and void ab initio. So you have to take consent of guardian and then only you can terminate. The third thing, that whenever we terminate the pregnancy, the material of the product of conception which comes out, that is the evidence of crime. So it becomes our duty to collect the product of conception in normal saline and to hand it over to the police so that they can use it to inquire or to reach to the culprit. Now another question which comes in mind, that sir, suppose patient comes who is minor, but it pretend that I am major. So suppose patient is of 17 years, comes to the hospital and tells doctor that I am 19 years old and please do my MTP. So in that situation, you always be cautious, because whenever a case is filed against doctor for conspiracy done with guardian or with any boyfriend, then in those circumstances, the burden of proof to prove the age will be on the head of doctor. So it is always advisable that whenever you are in doubt, you must ask school leaving certificate or Aadhaar card or any age proof to prove the age of the patient. Only after fixing the age, you can terminate the pregnancy. Now suppose there is no ID proof is available, then it is advisable to send that patient to dentist or radiologist to confirm the age so that they can give certificate that approximate age of this patient is this, and you can proceed with the termination or not. So these are the abundant cautions you should take while dealing with the minor patient undergoing MTP.
Yeah, one more situation in the same type of situation rather. If you, after counseling, you inform a guardian who is accompanying with this patient that I would, I will have to inform police before I proceed further. And many a times they refuse it. Or we do not want to inform police. And without taking further treatment from you, they leave your hospital. So in this situation also, are you under obligation to inform police?
If you have knowledge, so here knowledge is there, so it becomes your duty to inform police.
Yes. So simply it means whenever any responsible person or any citizen of India comes to know this type of crime under FOGSI Act, he is under obligation to inform either police or CWC committee.
Yes, yes.
Okay. Thank you very much, Sharma-ji. This is the gesture on part of you to discuss this type of small situation or query or question raised in our common FOGSian friends in their day-to-day practice. And it is known since long, you are good medico-legal counselor and you have delivered so many lectures across India in state conference, national conference, and in different associations. So you are doing a wonderful job. And I have come to know that this year you are going to go for contesting election of Vice President FOGSI from West Zone. And I think with a person like you, knowledgeable person in field of medical legal area, I think you are very much needed to serve, or you cater your services in a better platform on part of FOGSI to common FOGSian. So all the best for your election campaign, and carry on this type of services to cater your service to common FOGSian people. Thank you very much.
Thank you, sir, for blessings. and hope your blessings will be continuing being a senior. And I also appreciate that you are also going to contest for president in future. So hope wish you all the best for the same.
Thank you, sir.
Okay, sir. Thank you.